tooth mobility, if tooth becomes mobile, what is the reason for the mobility? Can anything be done about the tooth mobility? Is what we will look into this particular video. Hello, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja and Amalapuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel. We have got a whole bunch of videos coming out on dental health and awareness. So when it comes to tooth mobility, the first question is, when people come to us with mobile tooth and ask us, help me to save this tooth, the first question that comes is, why did you take such a long time to seek attention? Because when it comes to tooth mobility, unless and otherwise the disease process at an advanced stage, the tooth doesn't become mobile. Of course, tooth can become mobile for other reasons like a trauma or anything. In a general, normal, healthy individual, the tooth becomes mobile only at an advanced stage. The commonest teeth becoming mobile usually will be the lower anterior, the front teeth. That's which the teeth, because they have the shortest root. That's when the tooth becomes mobile. So now let's look into the process by which what causes this mobility. The tooth is with the root is embedded in the periodontium. What do we call by periodontium? We have our bone, which is called the alveolar bone, and the periodontal ligament that encompasses the root surface of the tooth and holds the tooth inside our bone. So this tooth is usually immobile. So, but even though I say it's immobile, there is something called physiological tooth movement. What it is, because the periodontal ligament is like a hammock. It's a suspension. So when during normal process, there can be a very slight movement of the tooth within the physiologic limits. So this is normal, nothing to be worried about, which is usually a normal process. It's a sign of healthy periodontium also, because healthy periodontium is a very robust and a very dynamic environment. So when it comes to mobility of the tooth, the actual mobility, it means that the periodontium is getting affected by a disease process. How does this disease process start? It usually starts with the plaque buildup. Plaque is nothing but deposits of bacteria with salivary minerals and food that forms a deposits on the surface of the teeth, gets hardened over a period of time, calling it calculus. Now these bacteria in these releases toxins, causes our gums to get inflamed. When the gums get inflamed, what happens is, usually it starts as a bleeding gum. There can be small swelling in the gums, can cause pain in the gums. We ignore at this stage. Then the next step is, from the gum, the disease process progresses to the next level, which is the periodontium. So when it gets periodontium, the bone starts getting affected. The alveolar bone, that is the housing of our tooth, starts becoming weakening over a period of time, slowly starts receding. So the gums also recede, the bones also recede. Now this is when the tooth starts getting slightly mobile. When it comes to mobility, we have graded the mobility into three parts, which is grade 1, which is a very slight mobility, about less than a millimeter, 1 to 2 mm mobility. Usually a to and fro motion can be there in the tooth, which is a very early sign of a mobile tooth. It's very, very important that we seek attention at this stage. Usually when we seek attention at this stage, by doing a thorough gum cleanup process, by doing a flap surgery, bone grafting, we can prevent the teeth from getting further mobile. We can usually protect the teeth. We leave the stage, it gets to the next stage of mobility where the tooth becomes grossly mobile. It's more than 2 to 4 mm of mobility is there on the tooth. It means that there is further bone loss. So when it comes to further bone loss, eventually what happens, this leads to the next level of mobility called grade 3 mobile, where the tooth is very highly mobile. In fact, when you press the tooth gets compressed into the socket, it goes in and then comes out. It means that there is nothing that can be done to this particular tooth. Extraction only will be the choice of treatment for that particular tooth, because it's a grossly mobile tooth. So what else can be done if you're going to identify this mobility? If you want to save the teeth, or we don't have time to do the next step, what can be done is, there is a process called splinting. What do we mean by splinting? Splinting is, we take the support of the adjacent healthy teeth, usually run a fiber and attach the mobile tooth to the other teeth. So this helps to protect the teeth that is mobile, prevent any harmful forces on the teeth, and also helps to limit the disease process. But what's important in splinting is, we should first stop the disease process by doing a gum work to clean up the gums to ensure the disease process is not there, so this splinting can be effective. Because if we miss this, even though the tooth is splintered, the disease process can further progress, causing eventually loss of teeth. Of course, when loss of teeth happens, extraction is the only choice, and then replacement of the tooth either with a fixed partial denture or an implant will be the choice of treatment, which we can always look into it in another video. Hope this video helps. If there are any questions on the splinting or what can be done to prevent a loose teeth, please do ask in the comment section below. And do like the video, subscribe to our channel. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.